Guys, what's up? So long time no see. I am so sorry that I just kind of left you guys hanging with this quarantine and stuff. You'd think, dude, you have plenty of time, make some lit content, but that's just not been the case. I've had to go to the ER 2 times now in the last like 2 weeks, and I've had an MRI since I've talked to you guys last. So I'm gonna go ahead and take a pause here and insert some of the pictures because I was in a tent hospital, which was really weird, but I'll show you kind of what that looked like. The pictures that I can show you, just can't show you all of them just because of other people's personal information and my personal information. But yeah, here's a couple. So you guys can see that was very interesting. A little creepy because where I live it's very windy at times, and so that one of the nights I was there, it was super windy and it scared me a little bit. I got anxious, but it was just like an addition to the anxiety I was already experiencing because I have anxiety about hospitals before there was a pandemic, and now like my worst fears happened. I stocked soaps and Germ-X before it was like the thing to do. So from that aspect, since I had gotten better about overuse for that, we did have extras of that kind of stuff when it started to run out around everywhere. But anyways, that's aside the point. I went to the hospital. So here's what happened that put me in the hospital the first time. I was having crazy amounts of pain. Nothing was working, and you guys know I like swear by the CBD roll-on, and it was even not helping, and it just hurt everywhere, and we couldn't get it under control. And then I contacted my doctors. I was like, I think that I need to get some IV fluids. We don't know why or how or like what it is. There's ongoing studies about it, but for some reason when I get IV fluids, I'm like a new friggin' person almost. I drink 2 to 3 of these a day. So it's not like I'm dehydrated. It's like 60 ounces, which is very close to a gallon. So yeah, water intake is not the problem because I take in at least that, and then other fluids like I have Gatorades, Powerades, Pedialyte. It just depends on my mood, what I'm in a taste for, you know what I mean? So before you hit me with the drink more water, that's not what the problem is. There's something with my body absorbing it that's just not happening right now, you know? So working on that, I got some IV fluids. My doctor was like, I can't give it to you in my office. You have to go to the emergency room, but he put in a note saying to give me fluids. They did that, and by the time they got to me, I was in so much pain that I was crying and kind of having a panic attack. So then they gave me lorazepam, I think it was. The name brand, I think they said was Ativan. I don't know. Either way, it worked. Yeah, I was nice and chill after that. They got my blood pressure under control because when I get anxious, my blood pressure shoots to like stroke level. Like it's so bad. And then the combination of pain and that, not a good mixture. So that was the first time. They got me loaded up with some fluids, got me something for my anxiety, and they were like, it can help kind of calm those, I was having like muscular pain and nerve pain, and they were like, well, it just kind of helps you relax in general, so hopefully it'll help with the pain as well. And I don't know if it was that too, you know, or just that I had also gotten a Toradol shot. I'm not sure which of those 3 things actually worked. 3, not 4, I don't know. Can't count today. 3 things actually worked, but we got it back under control, and the next day I was doing okay. I was able to manage it at home. I did a lot of just different little things, and then that happened on like Tuesday or Wednesday of that week. And then that Friday, something happened when I was talking to my parents, and I turned, and I don't know, like my knee must have not turned with me or something, but my dad heard it pop. And my dad, not that he has bad hearing, but like he has very focused hearing, and he was in the middle of like his Bible study. They were just like chatting and stuff, but he's just like, when he's in a conversation, he's there. But he heard it and turned, and I was like, it just like this horrible pain. Usually I'm able to kind of like limp to wherever the closest chair is, but I fell. I just kind of fell down to the ground. It was embarrassing, but it was back in place. Made sure it was back in place. My dad checked it, and I was like, okay, it's just, you know, usually when I dislocate joints, it sucks for a little bit, and then I wear a brace for a few days and I'm fine, you know, because that's just the way Ehlers-Danlos syndrome works for some people, especially me. Things dislocate all the time, put them back in, wear a brace on it a few days, I'm good, you know. But my pain got really bad. I think it was that Sunday night or Saturday night, I can't remember, but my pain was back through the roof. And as those of you who followed me for a while now, you probably know this, but if you don't, I have a tear in my labrum of my, I think labrum's how you say it, of my left shoulder. So I can't really do crutches. So my mom took me, got me a wheelchair, left me there, because nobody can stay with you in the ER right now unless you're underage. Some of the ERs are a little more lenient and they'll let you have like one person, but the one that I went to was not, but that's where my insurance has full coverage. So had to put my big girl panties on, you know. So I went in there, they checked me out. The guy was like, something's definitely not right, you need to stay off of it. Here are some crutches. Well, I can't really use crutches a lot. They couldn't order me a wheelchair because they didn't have enough evidence to get to give the insurance enough proof. They're like, if I do that, it's gonna come back on you. So fine, you know. So he was like, just use it very minimally and use the crutches like for stuff that you absolutely have to do. No, I was like, okay, cool, you know, that's a deal. And so I did the MRI, and I just got the MRI results, not from a doctor yet, so we'll see how a doctor interprets it, but it says a possible tear, and it gives like the images, and then it gives the images for somewhere where you can clearly tell that my patella has been moving around. And I didn't realize that people's patellas don't usually move. And when I was checking my right kneecap, which is the one that's fine right now, it's usually not the case. It's usually my right side falling apart, but my left decided it needed to turn. But like, I was like, oh yeah, it really doesn't move as much as my left one does. So got patella instability, so I'm not exactly sure what they're gonna do. There is the possibility for surgery depending on the tear, but with Ehlers-Danlos syndrome, they really don't like to do surgery because our tissues are so crappy that it's probably gonna tear again or exacerbate the issues because they can't do it. I had one person a doctor who worked with Ehlers-Danlos syndrome patients, who described it as trying to sew tissue paper together. So if you've sewn before or cut tissue paper, you know how like flimsy that is, and it's not as effective as if you're trying to sew together fabric. You know what I mean? So that's where we're at right now. It's kind of a hard decision, but I probably will go ahead and do that because
alrighty, everyone, it's 2, 3, 4, or 5.
Sorry guys, my class started back up. They're just taking roll right now. So oh, it's dark out here, but we are going to talk to my PCM on Friday, which is actually tomorrow. Yeah, so we're talking to him tomorrow about everything that's happened. The results, and my blood results are just like not great, and a lot of them stem from dehydration when I was doing research on what the different numbers meant, and all of them have to do with some kind of dehydration, which would make sense since we're kind of finding out that my body isn't really taking in the fluids properly. So yeah, we are doing that, and I've started my at-home job, so if I do need surgery or something, it won't be as big of a deal, you know. I'll do it on the couple days off that I have, and then I'll be able to just kind of chill at my house. Like, I don't have to go far, you know, not a big hassle. So yeah, that's the plan for right now. Just waiting to hear exactly what the doctors think, but yeah, it's kind of where we're at.